Now moving on to the second topic, like we have finished one, now moving on to two. Two basically stand for medicines for pain and palliative care. All of you know palliative care. I have explained this in my previous videos. Medicines for pain and palliative care. Here we basically have two important ones. First is 2.1, second one is 2.2. In 2.1 we have non-opioids, and now we have a new classification, like NSAIDs is old. It is NSAIM, non-steroidal anti-inflammatory medicines. M stands for medicines. Non-steroidal anti-inflammatory medicines. Okay, now it is not NSAIDs, it is NSAIMs. Great, excellent. So this is 2.1. I'll be discussing the drugs first here itself, and then I'll be moving ahead. First, in this very commonly used, yeah, excellent, all of you know that very well, that is acetyl salicylic acid, also known as aspirin. Acetyl salicylic acid is a chemical name, aspirin is a generic name, and brand name can be Ecosprin, any brand name, you know. Then ibuprofen, and last but not the least, the most commonly used NSAIM, absolutely safe in pregnancy, breastfeeding, lactating mothers, all of them. It is very, very safe. Like you can give it to elderly, neonates. We have paracetamol syrups in case they have high fever. Okay, great. So now moving on to opioid analgesics. 2.2 stands for opioid analgesics. Okay, so in this number one, what we have, yeah, codeine. C for cough, C for codeine. So it is one of the drugs of choice for dry cough. Suppresses the tussle, meaning the main cough center. Where is it located? Tell me the location in the YouTube comment section. Waiting for your comments. Number two, I'll be talking about morphine. And then thereafter moving on to the complementary list. Like this is the complementary list which I told you, every essential has a complementary list. In complementary list, the drug which we use is methadone. Clear so far? Great, excellent. Now moving on to another category of drugs, that is medicines for other common symptoms in palliative care. Okay, like I told you, I'll be telling you about the palliative care drugs. So yeah, starting off with each of them. First is amitriptyline. Now this is basically a tricyclic antidepressant. I would sincerely appreciate if any one of you could please tell me the mechanism of action of amitriptyline in the comment section below. Then moving on to cyclizine, please tell me which group of drugs does it belong to. This is followed by dexamethasone. Again, which group of drugs does it belong to? Waiting in the lovely beautiful YouTube comment section for your beautiful comments. Then moving on to diazepam, belongs to the group of benzodiazepines. You can mention it in the comment section as well. Then another great drug here, that is docusate sodium. What do we use it for? Yeah, please mention it in the comment section. Waiting for your lovely beautiful comments. Then we have fluoxetine. Fluoxetine belongs to which class of antidepressants? Yeah, please mention it in the lovely beautiful comment section for you. Then haloperidol belongs to which group of drugs? Please do mention it in the YouTube comment section. Then talking about hyoscine butyl bromide. Hyoscine, which group of drugs does it belong to? Please mention it in the YouTube comment section. One is hyoscine butyl bromide, another one is hyoscine hydrobromide. Clear? Hydrobromide. Then moving on to lactulose. Okay, lactulose, how can it, which class of drugs? Yeah, please mention it. Then loperamide. Then metoclopramide, which group of drugs does it belong to? Please do let me know in the YouTube lovely beautiful comment section. Then midazolam. Finally, we finish off this class with the most important drug, last but not the least, ondansetron. This is an antiemetic. Which group of drugs does it belong to? Do let me know in the YouTube comment section.